Hi guys, I'm Dr. Iraniha. I'm a board certified general surgeon, and I have been in practice over the last 2 decades in Southern California, Orange County, Newport Beach area. My main interest is minimally invasive surgery, including robotic and laparoscopic operation, and my main focus of the practice is major and complex abdominal wall hernia repair and body contouring. The videos that you're going to see is my experience through bilateral knee replacement. Unfortunately, I have developed bilateral knee arthritis and is associated with the pain and discomfort, and I need to have this type of operation in order to recover and go back to my normal life. And I thought it would be very interesting for people to hear and see my actual experience through this operation for multiple reasons. Number one, it's because of my unique age group that I'm going through this operation. Number two is that I'm going through bilateral knee replacement, and I watched so many videos on the social media, and I didn't see that many people with the bilateral knee replacements and sharing the experience, and I thought might be helpful. And the other last reason is that I'm a surgeon myself, and I deal with patients post-operative pain and discomforts and recovery, and I thought looking at this operation from a surgeon eyes and also a patient perspective might be very helpful, and that's why I'm going to share my experience with you. But again, I'd like to emphasize that I'm not an orthopedic surgeon, and I'm not a certified and licensed physical therapist. So whatever I say in these videos and what you see from my post-op recovery, including my pain medications regimen and also the exercises that I'm going to show you, are not a medical advice. If you have any question or concerns, you definitely need to talk to your orthopedic surgeon or discuss the matter with your certified and licensed physical therapist.
Hi guys, today is day number 10 after my bilateral knee replacement, and I'm feeling much better today. Since last 10 days, every day I had a little bit of low-grade temperature up to 99.3 to 99.7, and these episodes of temperature comes in on and off, mostly at night, and I get a little bit chills and a little nausea, and you go away. I still don't know what that is, but I think it's most probably related to the significant inflammatory process of my knee surgery, because overall I'm feeling much stronger, and my swellings are better. I don't have that much redness, and bruises are going away gradually. And obviously today I felt so good after I did my routine exercises, including that minimal upper body exercise that I do without moving my knee as much. I was able to take a shower and just walk outside of the house, and I was able to almost walk close to 2 blocks to come to the little park next to my house, and I thought maybe I can share that with you. Obviously, I thought what's interesting to share with people that are going to or went through this type of operation is the emotional aspect of this surgery. When I look at my life, my life was not always rosy and beautiful and happy. I had a lot of ups and downs in my life, and most of the time, if I had obstacles, I was trying to take advantage of my mindset, my self-esteem, my fitness, and work ethics to solve those issues. And I was always successful going through that. But this time is very different, even though I consider myself a very mentally a very strong person. But when you get double knee replacement and you basically essentially crippled for the first week or so, and with the very busy lifestyle that I have, it was a huge shock to my mental state. And there's no question that it's pulled me down significantly at times, and I had to fight with it. And majority of times, the way I try to fight with it is to see the future and hope for the best and hope for the future. And when I don't have that much swelling and discomfort, and be able to go back to my normal and heavy activities. But I don't want to. When I started filming my experience, of course, I thought it might be a success story and it might be helpful, but I don't want to just say the success part of this process and journey and the things that I went through. I think is important to share, including my emotional ups and downs. And one of the thing that really affected me is inability to do my regular work. I'm a busy surgeon, and I have passion about what I do, and I really love my career. And being at home and unable to go to work really make me feel useless, and at times it put me really down, and that's why I wanted to share that with you. But going out, walking around, taking deep breaths, fresh air and sunlight, as well as family support, really helps to go through this emotional ups and downs. And I'm sure that sooner or later, after I get my mobility back, I'll be back to my work and resume my normal activity and try to be more useful again. So that's the emotional ups and downs that I went through. But I think one of the things that has helped me is not taking narcotic pain medications, because I've seen it a lot when people take a lot of narcotic pain medications. It really affected their mood and made them more depressed, because it makes you more lousy, and of course it decreases your pain, but because it makes you more lousy, it really bring down your mood. And I think one of the advantage that I had in this journey is that I stopped the narcotics day number 2 after my surgery. I'm not saying that I didn't have pain. Of course, I had some discomfort, and of course, I used regular Tylenol and some anti-inflammatory medication, but not using narcotics really helped me to be able to control my emotion. And and I think one of the message that I would have for people who go through this operation is that if you set your mind that you will have a miserable time, and you will have massive amount of pain, and you need to take pain medications around the clock, I think you set yourself for failure. I think definitely having this mindset that of course that I'm going to have pain, of course it's normal after this major and massive operation, but I'm going to try not to take as much pain medication, especially narcotics, so I don't get the side effects of those, and causing more problem during my recovery. So that's the message that I would have for my for the other people that go through that area. Of course, people have different threshold of the pain, but majority of time, pain is actually a little bit helpful because it gives you a little bit alarm of how much you do. If you're taking too much pain medicine and laying down on one side and putting too much pressure on your incision, and before you know it, after a couple hours, you get more swelling and discomfort because the pain, you basically cover up the pain, and that alarm of your body did not help you to move and change your position, and or during the exercise or activity that you're supposed to do after the surgery. If you're taking too much pain medicine, you don't know how much activity you're supposed to do and when to stop. I think pain is a mechanism for our body to help us, to guide us through this recovery. So that's why I'm not recommending not to take the pain medication, but I'm recommending to definitely adjust it and try to minimize it and wean it down as soon as possible. So today is day number 10. I'm feeling good. I'm going to go back home and walk back home, probably around another couple of blocks, and then try to rest my leg since I did too much today. I will keep you posted. Thank you.